I'm Dr. Niti Pal, and I'm a doctor based in the UK. I'm a family physician, a GP, as we call it in the United Kingdom. I also worked in healthcare management in the UK NHS. I was Director of Primary Care in the NHS a long time ago. The NHS has very long waiting lists currently, and you probably heard all the news about the NHS waiting lists. You still get pretty good non-elective care in an emergency in the UK, but elective care is quite challenging because for some routine operations like hips and knees, it's very long, the waiting list. So I came to India. I needed a tooth extraction and I needed an implant. And I chose to get that done here in India for many reasons. The most important thing for me was the ease of access to the doctor, the high standards of hygiene that the dental surgery that I go to here has, and the fact that I was given an appointment within 4 hours of actually phoning them. I had my tooth extraction done with a very well-qualified dental surgeon who took me through the whole procedure, but then also put the implant in almost immediately, so I didn't have to wait weeks to get an implant done as well. The fact that the doctor was able to handhold me throughout my treatment, and the fact that I knew that I was getting the best possible care. So just getting it done quickly, easily, and of course at a great price really mattered to me. So when people think about India, they think about the quality of care not being so great. But actually, if you walk into an Indian hospital today, or you walk into a dental surgery here in India, the quality of care and the hygiene standards are much higher than some that you will see in the UK. The other thing that I find in hospitals in this country is the quality controls are actually quite transparent. You can see them written on walls, that you can actually see what they are, because most big hospitals in this country now are NABH accredited, if not JCI accredited. So their worries really are the standards of quality that you're going to get, the standards of care you're going to get the same as in the UK, or are they better? So, they really need to know whether the quality of care is better. And I can assure people that it is. The second thing that people look for is the ease of access. How can they get access to the professional quickly and easily? And how can the professional then comfort them to know what their treatment is going to be, how long it's going to be, where they're going to get their aftercare? Because obviously, if you're having a bigger operation, I just had a dental implant, and it's not a huge thing, but if you're having a hip operation or a knee operation, you need recovery time. So where is the recovery going to happen? How quickly will that happen? Who will look after me when I have my recovery? My family might not be with me, and I might have to travel for that. So those are the sorts of questions that people worry about. And obviously, with the platform that we're working with at the moment, they have a concierge facility. They also have a treatment facility in which aftercare can be provided well, with good quality nursing and good quality occupational therapy, physiotherapy that is available 24/7. So most people would like to travel with somebody, that's for sure. They'd like to have a loved one with them. But if you don't have a loved one with you and you do need someone to handhold you, then an aftercare facility that actually looks after you in that same kind of homely environment that you would get back home, and someone to actually be your personal attendant to take care of you, is quite a unique feature, because in the UK you will get care. Absolutely you will. The social services are very good in the UK and you do get lots of care, but it can't be 24/7. Here it's 24/7. You've got nutritionists who are looking after your diet, you've got a physiotherapist who's looking after your mobility, you've got a nurse on call, you've got a doctor in case something goes wrong, and that's not often easy to find. I mean, there are many hospitals in this country who do operations, but then on the third or fourth post-op day, you're out. And then you've got to fend for yourself in a hotel or an Airbnb or somewhere. This is completely different. This changes the game, I feel, in terms of how quickly you recover. And like I said, as a doctor, when I've seen patients recover from their operations, that really matters, that post-operative care. So I think when somebody's considering coming to India, they need to look at the quality of care, the type of hospital, whether they have quality accreditation or not, what the qualifications of the doctor are. And the second thing, obviously, is the doctor that you're going to meet in India talking to your doctor in the UK. So that's a big part of what the patient would be looking for, is that their own doctor in the UK can have a conversation about their condition to the doctor that they're going to meet in India who's going to do their surgery. I think that hand-holding between the two professionals is something you should be looking out for, because then that makes your transition of your care both to the UK and then back home is much, much better. So I think the post-operative insurance cover for complications when you're back home in your home country is a really big step, because that will cover you in case you need to have re-surgery or there's some complications. The insurance will cover you in a private facility. Sure, there's the NHS to pick it up if you have complications. We still have the safety net of the NHS, and there's no denying that. That's a big thing. But obviously, again, that's not private care. And if you're choosing to pay for your care, you would like to go back into the private system if you were recovering, and the insurance would cover that. So that's a very big part of the offer. I think the real issue here is, I still see patients who are in a lot of pain, who are waiting to have their hip surgery or their knee surgery, and it's not nice. Also, your life comes to a standstill. The real thing is to get your life back together. This gives you your life back quickly. That's what you're looking for. I think my parting thought really is for people that are thinking of traveling, is that don't discount India as a quality destination. India was never viewed as a quality destination. The world has changed around us, and it sure is. Many doctors in this country have trained in the UK, they've trained in the US, and they're back here practicing in this country. And they're very well qualified, and actually they do many more procedures than a lot of us do back home. So it's a great place to start. But if you're thinking of travel to India for an elective operation, I would highly recommend that you do your research, speak to the doctors that are available on the platform, reassure yourself that they are the right kind of doctor for your surgery or your treatment, and that your own doctor in the UK that TMTC will give you, a GP, a nurse, a care coordinator, will handhold that whole journey through.